Calcium metabolism. Normally, the calcium level is 9 to 11 milligram per dl in our blood. Its action is help in development of the bone as well as teeth. In muscles, it causes contraction. It helps in blood coagulation by activating certain clotting factors. It helps in nerve transmission and it works as a secondary messenger. Now let's look at calcium absorption. It is inhibited by calcitonin. It inhibits calcium absorption. It is stimulated by vitamin D, which increases calcium channels in small intestine as well as in kidney. Parathyroid hormone also increases blood calcium level, as we remember by the mnemonic PIVKA. Parathyroid increases blood calcium level. It helps in bone resorption. In kidney, it aids in the secondary active transport of sodium and calcium and hence helps in absorption. As a little summary of it, the calcium decreased calcium level is its main stimulant, hypocalcemia. It leads to release of parathyroid from the parathyroid gland, works on bone, increases resorption, and increases calcium efflux. In kidney, it activates 1,25 dihydroxycholecalciferol and leads to resorption of calcium and phosphate. And in intestine, it also helps in calcium resorption and phosphate absorption. Let's look at the clinical aspects. In hypercalcium, level increases, which depresses our nervous system, as calcium level is more than the sodium level. Also, increased calcium level can lead to kidney stones. Whereas in hypocalcium level in blood, it can lead to tetany and in convulsions. How? As there is low calcium level, the number of receptors on the cell membrane increases, such that a small amount of calcium can cause massive contraction. It can lead to tetany and convulsions. Vitamin D deficiency in children can lead to rickets. Now, this rickets itself can be used as a mnemonic to know its symptoms, such as R stands for ricket rosary, I from improper growth, C for craniotables. Craniotables is protrusion of the frontal of the head. Knock knee, these are knock knees or the bow legs. They can be large end of bones. Large end of bones means large epiphyses. Then there can be tetany, as we know, contractions, and the bones can be very soft. As seen from this image, it can be seen there is delayed closure of frontinels and frontal blossoming, craniotables, and rachitic rosary. It is seen in the ribcage area and protruded stomach. In adults, it leads to osteoporosis, means demineralization of the bones. It also causes carpopedal spasm. These are cramps seen in the hands area where the hands can be seen as a curl or a claw hand. These are very painful contractions and lead to tingling sensations in the hand.